Hi, everybody, and welcome to our Telehealth 101, How Do I Get Started During COVID-19? My name is Rebecca Picasso, and I'm the Program Director for the California Telehealth Resource Center. And also, we have Kathy Chorba, the Executive Director of the California Telehealth Resource Center. So what are we going to talk about today? We're first going to talk about that the California Telehealth Resource Center is a federally funded telehealth resource center that was established in 2006. We're one of 14 located throughout the nation. There are 12 regional and 2 national. And portions of the information on the slides that we're presenting today were developed in conjunction or in part by other resource centers and are being used with permission. So under normal circumstances, you would implement telehealth by going through a pretty extensive implementation process. You would do a needs assessment to figure out what your patient need is, what your provider need is, what type of equipment you need, and so on. However, due to the current public health emergency, healthcare providers are really being encouraged to utilize telehealth as often as possible to see their patients. So this Telehealth 101 presentation is for healthcare providers that are interested in implementing web-based video to interact with their patients. It's not going to cover other types of telehealth such as store and forward or remote patient monitoring, and we're also not going to address certain equipment types like telemedicine cards or medical peripherals. So the first thing that you want to do is you want to determine your need. You want to consider what it is that you're trying to accomplish. Are you going to use video visits for initial patient visits, or are you going to use them as a substitute for in-person visits completely? Are you going to use them for follow-up? Are you going to use them to determine whether or not a patient needs to come into your clinic? And is it the intent of the healthcare provider that your patient initiates the video visit, or do you want your provider to initiate the video visit? These are all some things to think about before you start heading down the road of how do I do this and what do I do? You want to determine what it is that you need first and what it is that you think you might want to do. So let's talk about really quickly some common evidence-based telehealth uses. If you haven't thought about this in the past, there are a whole host of specialties and subspecialties and different things that you can do over telehealth that maybe you didn't think about. Primary care is absolutely on there. I'm not going to go through everything on this list, but this list absolutely includes 60 just to get you started thinking about the different types of things that you can do with telehealth. Let's talk about software and equipment. It's generally a really good idea to take a long look at the type of technology or the software that you want to use. However, during the current national public health emergency, it may not necessarily be feasible for you to spend a lot of time figuring out what technology works best and what software works best. Also, the government and local state agencies have provided some flexibilities for you right now with regards to what type of equipment you can use. So whereas, for example, CMS outside of the public health emergency has stated that cell phones are not appropriate for telemedicine and telehealth services during the public health emergency, they are allowed and accepted. Um, Also keep in mind that right now some of the video vendors and some of the technology and equipment vendors are offering free or reduced pricing to help support a quick ramp up of telehealth. So let's look now at some of the products that you can use. These are all off the shelf. You can go to Best Buy and purchase them. So what can you use? You can use a desktop with an external webcam. You could use a laptop with an internal webcam. You could use a tablet or a cell phone. A little note on tablets and cell phones. If you're going to use some type of mobile device, make sure that you have a stand for it. You want to not be walking around with your cell phone in your hand. You make patients kind of seasick as you're walking like this. So you want to make sure that that is as still as possible. And you want to encourage your patients to do the same. You don't want them walking around their house or pacing or whatnot. And you want it to be as still and stable as possible. So consider when you're using a mobile device purchasing something like this. So video platforms, let's talk about those. Um, the Telehealth Resource Center always suggests that you utilize a HIPAA compliant healthcare approved software platform. So what does that mean? That's typically a platform that is encrypted from end to end. It's a platform that offers a BAA. And it's typically a software program that's meant for healthcare services. However, during the current public emergency, the Office of Civil Rights has temporarily relaxed its standards for you all to use certain non-HIPAA compliant products. So what does that mean? Can I use FaceTime? Can I use Skype? Right now, the answer is yes. You absolutely could use those products. Um, you need to, if you're going to use those products, you need to make sure that you are informing the patient that there may be some privacy risks associated with using a non-HIPAA compliant platform. And let's be honest, it takes about the same amount of time to use something like FaceTime or Skype as it does for you to use something like Zoom or Doxy.me or whatever. Using a HIPAA compliant platform is best practice. It should be used wherever possible. And it takes just as much time to use one of those as it does to use a non-HIPAA compliant platform. So what are some of those platforms? So the Telehealth Resource Center is absolutely vendor agnostic. We can't really give you any guidance and push one for one vendor over another. But what we can do is we can list kind of pros and cons. So, we could tell you, hey, Zoom has these types of capabilities, which may be something that you're looking for, or Doxy.me may work best for you because you're looking for, A, B, and C. We can give you a little bit of guidance, but we absolutely are vendor agnostic and we won't be able to push one vendor over another. But this is some of the examples of what's out there, and there are so many more available to you. If you have an EHR or a patient portal or anything like that that has integrated video capabilities, absolutely use that. There's no point in you recreating the wheel or purchasing a software platform that you don't really need if you've already got something that's going to work for you. So some practice considerations to keep in mind. In California, we normally require verbal or written consent for telehealth services. Um, on April 3rd, our governor actually removed the consent requirement completely for telehealth services. So during COVID-19, for the remainder of the public health emergency, telehealth consent is not required. However, at a minimum, since our state only requires verbal consent, there's no harm in verbally consenting the patient. Doesn't take a whole lot of extra time, just to make sure that this is something they're comfortable with. If a provider somehow maintains a general consent to treat and it specifically mentions the use of telehealth as an acceptable modality, then that is sufficient for documentation of patient consent. Identification and authentication. You guys want to just go ahead and take a few seconds and ask to see your patient's photo ID and ask them to hold it up to the camera so that you can see that you're really seeing Sally Smith and not, her neighbor from down the street. This is especially important when you're seeing new patients that maybe you are not familiar with them and don't know what they look like. Alternatively, you could obtain copies of their driver's license or photo ID, their insurance cards and whatnot prior to the visit. But it takes just a few seconds for them to hold their ID up to the camera and show you that they really are who they say they are. You want to make sure that you have a backup plan and a specific plan for any emergencies that might arrive, including maintaining a list of the client's local emergency resources. Should anything happen, you want to know where to direct the patient or where to direct emergency personnel to. Um, If you're able to, you should definitely consider screening patients for appropriateness of telehealth. Not every patient is appropriate for telehealth, and so just a quick basic screening to figure out who's appropriate and who's not will save you a lot of time in emergency care. So let's move on to camera location. So camera location is super, super important. So you want to create the illusion of eye contact because let's face it, we're not all going to stare at the little hole at the top of our laptops and look at the camera all the time. We're going to be over here and, charting, and we're going to come back and we're going to be looking down at our taskbar and things like that. And so what we want to do is we want to try to create the illusion of eye contact. So how we start doing that is we want to make sure that our camera is centered on the screen. So it's directly in front of you and centered on the screen. You'll notice that if I take my camera and I move my camera just over 6 inches and I look at my screen again, it doesn't look like I'm looking at you because my camera is now over here. And so you want to just make sure that this little camera is right there. And I am using an external camera and I'm mainly using it to be able to show you some of this stuff. So make sure that your camera is centered on the screen. You want to make sure that your face is pretty much centered in the video frame, and you want to make sure that your camera, as much as possible, is kind of like here-ish, like right about the top of your hairline, maybe at the top of your hair, but it should kind of sit here. And what that does is that starts to help create the illusion of eye contact. The other thing that you can do is you don't want to put your face too close to the screen. Right now I'm looking directly at my camera, but if I look at my monitor directly in the middle of my monitor, I'm no longer making eye contact with you because I'm too close. If I just back up just a little bit from my monitor and my camera, now no matter pretty much where I'm looking on my screen, it appears as if I'm giving you eye contact, at least to the best of my ability. And so, if you're finding that you're not really engaged with your patient or your patient feels like that you're not looking at them, try backing up from the screen just a little bit. Um, the other thing that I want to show you guys is something about lowering the camera and raising the image. So I'm going to move my camera. You'll have to forgive me here. And I just want to show you that if my camera is too low, that doesn't give me a very good look. It's not a very good image. And so this is too low. But if I want to raise the way that the image looks, I can just slowly bring my camera up. And you'll notice that the higher I move my camera, the more the image is raised up. And so if you're using a laptop, I'm going to put this back, guys, excuse me. So if you're using a laptop, let's say, and you realize, oh no, my laptop is like super low and it doesn't matter what I do with it. I can't get the camera right. It's not up here with my head or this or that. Try putting some books underneath of it. Or try putting an empty box or something underneath of it and put your camera on top, or put your laptop on top of that box, and that will help raise up the laptop, which then helps raise up the camera and raise up the image. So just keep that in mind if you feel like your image is too low. So in this picture here, this little square with the circle in it is meant to represent a laptop camera, and we're just going to kind of go through real quick. So this doc here, he's got his camera right about in the right spot, and you'll notice that that is giving the illusion of eye contact. He's not actually looking directly in the camera because, he's talking to the patient, and your patient isn't going to be viewable to you in your camera lens. They're viewable to you on your screen. And so having that placement there kind of gives you that illusion of eye contact. So let's talk a little bit about framing and background. Again, you want your camera to be at that kind of hair level. You don't want it too high or too low. You want to fill the frame with your body all the way to the top if you can. So, we don't need to see floating heads cut off right here at the chin. We don't also necessarily need to see your full body unless you want to show that. So usually what we suggest is kind of either, mid chest up or waist up, but make sure that you are close enough to the camera or far enough away from the camera that your entire body basically fills up the frame of the video. Include your hands. I'm a hand talker, if you couldn't see, and I'm trying to attempt to include my hands in this, but sometimes I forget. But if you're a hand talker, you want to make sure that the patient can see what you're doing with your hands, because otherwise, if you're down here and you're talking with your hands, the patient is like, what the heck are they doing? What's going on? That looks totally weird. So make sure if you are talking with your hands that they're visible, and that the patient can see them. You want to avoid any intrusive backgrounds if you can. So for example, I have my office back here. That's probably what most of us are going to be, having as our background. But if you have a tie-dye rug and some black lights and whatnot behind you, you might want to rethink that. You don't want it to be too overly busy. You don't want it to be too bright. And you want to avoid something that's called backlighting. So let's talk a little bit about lighting here. Normally, our standard office workplace lighting is good enough, but we're all working from home right now, and we all have all kinds of lighting stuff that we never thought was an issue. And so the general principle that you want to follow is to use bright, diffused light from the front. And what do I mean by that? So I have a ring light. I borrowed it with no intention of giving it back from my teenager. And it's just a cheap little ring light that she was using for selfies, but it works really great to fix the lighting issues that's in my office. So I'm going to go ahead and turn it off for just a second, and I'm going to show you what I mean by backlighting. So I have a light overhead, and when I turn off this ring light, all of a sudden I'm shadowed. I'm very shadowed, and I have harsh light coming from back behind me, kind of almost pushing this way. It is from the ceiling, but it's not very easy to see me right now. And so if I just turn this little light back on, I'm a lot easier to see. The lighting from up above isn't necessarily interfering with my image anymore. And, patients can see that I'm here. This is, I don't look like the shadow guy in the little, in the slide there. So if you don't have a ring light, you could use lamps. Keep in mind that sometimes lamps will throw shadows. So whenever possible, use two lamps. Put one on the left and one on the right, that have like the diffused light. You don't want spotlights. So you don't want a light that's going to make it look like you're holding a flashlight and to your face and being spotlighted like that. Um, if you do have shadows, you know, try to get a light source to balance out the shadow. Sometimes if you have a lamp just on one side or you have a light source coming from just one side, putting another light source on the other side will help balance that out. Windows. I have a window kind of in front of me, but you want to make sure that your windows are either in front of you or to the side of you. You don't want a window behind you as much as possible, because that then will take light and it will backlight you and it will push that light forward. So you want to avoid windows in the back behind you as much as possible. If you do have a window behind you, use curtains. Blinds can sometimes throw really weird lights. So if you have curtains available, those work better than blinds. And then you want to make sure that you don't have any lights or reflective backgrounds behind you. And because that'll throw the light back this way and it'll give you that backlit look again. So if you have high gloss, like on your paint on your walls behind you, you might want to put something up behind you in order to reduce the glossiness of that just a little bit. So privacy and security. For most of us in our normal workplaces, we're probably in a pretty secure place. But when we're at home, there's stuff we don't necessarily think about. So you want to make sure that your work area has sufficient privacy. You don't want people to be able to walk through the space while you're on a session with a client or a patient. You don't want to be doing these video visits from your living room or your kitchen. If you have others, living in the house that will possibly walk through or hear or anything like that. Alternatively, if you are in a secure location, behind a closed door, make sure that there's no glass, see-through glass behind you so that others couldn't, peek in and watch your sessions and whatnot. And you just want to do the absolute best that you can to make sure that your sessions are private and secure so that your patient can feel as comfortable as possible. And honestly, this advice goes both ways. You want to make sure that your patients are also in a location that is private and secure. Um, and just advise them on that. So let's talk about sound. I have one of these beautifully, well done mic on, and there are lots of these styles available. And what you want to do is you want to choose one that is the least intrusive. So you don't want like the big Beats headphones that look cool when you're out on your own time, but maybe not so much when you're trying to talk to your patients. So you want something that's as visibly not succinct, I'm sorry, as visibly stealth as possible. You want it to just kind of look as normal as possible. So get one that's the least intrusive. And they usually have noise canceling mics here. So this is a noise canceling mic. So if there's stuff going on in the background where you're at, the noise canceling mics do help to reduce some of that background noise. If you're on video with your patient and you're hearing feedback, usually that feedback is caused by two audio connections happening in close proximity to each other, most likely in the same room. So using Zoom as an example, where we see feedback from is usually someone has logged into the Zoom meeting and they are using computer audio, and then they've also dialed in on their telephone and they're using telephone audio, and neither connection is muted. And that's when you start to hear feedback. So you want to make sure that if you are using a video platform and telephone, that you're not, you don't have two audio connections going on. Echoes. Usually with echoes, the one that is causing the problem, the one that has the echo, can't hear it. So if your patient is saying to you, hey, I just hear an echo, like you are talking, two or three times saying the same thing, there's probably something happening with your audio, not the patient's audio. And as a pro tip, the mute button is your friend. We're all working from home. We're all trying to figure it out. And, sometimes a kid or a spouse or somebody may, need something from you when you're in the session. It's okay to, tell your patient, I'm so sorry, I'll be right back. Excuse yourself. Hit the mute button before you get up. And then, go tell your family or whomever that, you'll be with them momentarily, that you're finishing up, however it is. But use the mute button. Kind of the same thing if you're doing an interview-based specialty and you're talking with your patient and your patient is talking for some time and you realize that you're hearing some background noise in your environment, you can use the mute button while they're talking, and that way they're not hearing your environment as well. Just make sure to unmute yourself. So let's talk about some universal video etiquette. So everybody in the room should be on screen, or at least should come onto the screen and be introduced. So this actually goes both ways. This goes for providers and for patients. So if there's somebody in the room with you, they should either be on screen the entire time, or they should come on screen, be introduced, and then they should go off screen, but you should let the patient know, hey, Dr. So-and-so is going to be off screen over here to the left, or however it is, but just let them kind of know roughly where they're going to be in the room. And at the same token, if a patient has a family member in the room with them, you want to know that. You want to know if there's others in there as well. So you could just ask the patient, hey, is there anybody else in the room with you today? If so, could you introduce them for me? Or whatever. But it goes both ways. Everybody wants to know who's in the room. Make sure that if you do have somebody in the room with you on your end, that you consent the patient for that the patient knows it and they're okay with it and they consent to someone else being in the room. Oh, internet broadband considerations. This is a fun one right now. So, if you didn't know, successful video visits require adequate bandwidth, not only to your home, but to the device that you're using for these visits. And so, right now, everybody's at home. Kids are at home, there's no school, spouses are working from home, other family members are there. People are watching the latest Netflix craze, or they're gaming online, or they're watching movies, or they're playing, all kinds of different things. And that all takes up broadband. And so right now, there's an increase in the demand for broadband in your house. And that can actually really affect your video visits. Excuse me. So what you want to do is, as much as possible, ask those others that are in your home, hey, while I'm seeing these clients online, for the next 2 or 3 hours, or whatever it is, could you please not, watch Netflix, or could you please stop gaming? Or because you need that broadband in order to have the most successful connection that you can. You don't want somebody else to be playing video games and your video visit with your patient keeps freezing, or the audio starts getting all garbled because there's not enough broadband to go around your house for all of these things. At the same time, if you are using a laptop or a desktop, or even a tablet or a cell phone, and you have a bunch of windows or apps open, you want to close all of those. You don't want to have 80 Google tabs open while you're doing your video visits, because these also compete for resources on the device that you're using. So it's just best practice to close as much as you possibly can to give your device the best shot with internet bandwidth, as much as you can. So let's talk about some best practices about familiarizing yourself and normalizing this and practicing this. So everyone should be comfortable using the equipment and the software. Everyone means you, everyone means your patient, everyone means everybody that's going to be involved. How we start getting comfortable with that is we use live video in low risk situations. Hey, doc, I think I might have pink eye. Okay, cool. Why don't we get on video and let's check it out? That's a pretty low risk situation, and a great way for you to practice and get comfortable with your patients, and have your patients get comfortable with using technology to see you. Practice as much as possible. Use mock encounters to learn what you're doing and figure it out. Now is a great time to involve family members if they're not in the same household with you. Ask them, hey, I'm going to try out this new video platform for my patients. Why don't we get together over this and use this platform, and why don't you help me practice and see what it's like, and this and that. And so there's different ways that you can practice and learn, but you want to be familiar with the equipment that you're going to use and with the software that you're going to use. So if possible, complete a pre-test call with the patient. Usually this is done by an office staff or an MA or someone who functions as like a super user. They know the software and they're super good at teaching people how to use it and troubleshoot. If you're at home, you don't have that person. And so it's best for you to just, try doing a pre-test call with your patient on your own. Check to see and make sure that both sides can hear and see each other. So if you can't see your patient, then that's a problem with their video. Maybe they haven't enabled it. If your patient can't hear you, you could be muted. Maybe you need to, hit the little allow button when Windows comes up and says, will you allow this program to use your microphone? Those things are stuff we don't think about every day, but if you're using a new program, it might be something you have to do. Um, if the connection's not great, again, limit what else is connected to the bandwidth and close any other extra windows on your device. So again, if you're choppy or whatnot, on your end, the provider end, make sure that there's nobody else utilizing a whole lot of bandwidth within your home. And then you can also advise the patient to do the same thing. Um, Help your patients again get comfortable with the experience. Keeping it simple and providing a little familiarity for them goes a long way. Um, have a backup plan. So technology does not always work, and you want to already have a backup plan for what if this doesn't work. Can we do this over telephone? Can we have the patient come in person? Like, what's our backup plan if technology fails us? And then most importantly, relax. Be yourself. These are your patients, and you're just using another modality to see your patients. And the more comfortable you are on video and the more comfortable you are chatting with them and acting as close to normal as possible, the more comfortable they tend to be. So, one of the things that we've learned over the years, and a lot of resource centers completely believe, is that a provider or a patient that has had one bad experience will need at least 10 good experiences to regain the trust in that technology or that platform. So, you want to make sure that as much as possible, you're doing everything that you can to make sure that the patient and yourself enjoy the experience. So let's talk about a couple of direct-to-consumer considerations. So direct-to-consumer is just when the patient is at the home or other location. They're not in an office. They're using their own equipment. Um, you will lose any physical control of the patient and their surroundings. You will rely on their equipment and their network. So if they're using an old cell phone that doesn't have, great video capabilities, you have to rely on that. If they're in a place where their cell network is horrible, you're going to have to deal with that. And so you rely on their equipment and their network. And keep in mind that you might need to verify that where the patient physically is during the appointment for safety reasons. If something happens while you're on the call, would you know where to direct emergency personnel to should you need to? There's not necessarily one solution to all of these risks, and it may be impossible to provide the appropriate treatment in some cases. Building rapport. How do we build rapport over video? So the first and most important, in my opinion, is we talk normally. Hopefully we don't get scared and video shy and start, talking really funny and weird and nervous laughing. You want to just talk to them as normally as possible. You want to look at your patient. So you want to ensure that their face is near the camera so that you can see them and they can see you. And you want to place your self view again in the frame of the camera as near as possible, but also keeping in mind that whole eye contact thing that sometimes when you're too close, it doesn't look like you're making eye contact. So you can back up. You want to use gestures. Be animated. Be yourself. But if you are going to use gestures and talk with your hand and point things out, that those are all on camera and in frame so that the patient can see what you're doing. Marketing. How do you market this stuff to your patients? Okay, I've decided to start a telehealth program. I've got, a laptop. I've got the software. I'm ready. How do I tell my patients that I'm doing this? And so you just want to consider how you would normally market to your patients. Would you use social media? Would you email them? Would you do like website infographics or maybe create a website page dedicated to that? Would you utilize videos? So consider marketing tools that are plain language and make it easy for the patient to understand the process. There's a picture of a video right below on the left side of the screen that is a patient-facing education video that was developed by the Hawaii State Department of Health, and it's really super great resource, explains in 6 minutes or less a whole bunch of different ways that a patient can expect things during a telehealth visit, whether it be at their home or in the clinic or whatnot. So consider videos like that. On the right side of the screen here, Borrego Health, which is NFQHC here in California, they put up a little telehealth services page on their website, and it very succinctly and easily tells the patient, what is telehealth, how much does it cost me, and how do I schedule it? And then they've also got a little thing there on the bottom about what do I do if I get disconnected, because it's important that patients understand what they should do if they get disconnected. And then again, to find out more information, call our clinic. So those are just some simple things that you can think about doing and utilizing when you're marketing directly to patients. But the biggest thing is to make sure that they're plain language and easy for the patient to understand no matter what you decide to use to market. Oh, reimbursement. So I'm sure throughout this whole presentation, you're all thinking, oh my gosh, just tell me how to get paid. So unfortunately, this presentation isn't going to go too far into depth into reimbursement. What I will say is that the California Telehealth Resource Center does maintain a telehealth reimbursement guide. Um, it is maintained twice a year at least, depending on how many policy updates and things happen throughout the year. Last revision was the spring of 2020. Now, this reimbursement guide does not cover COVID-19 policy changes because things are changing daily, sometimes hourly, and it would be impossible to continue to update the guide. So on our website, on our reimbursement page, right underneath that guide, we have COVID-19 reimbursement updates. We are keeping a list of CMS policy and reimbursement updates, DHCS, DMHC, and we're also attempting to keep a list of all of the managed care and commercial payer COVID-19 responses. So you should be able to find up-to-date information on that webpage. You are, again, free to reach out, shoot us a contact us form, send me an email, give us a call, and we'll try to get those questions answered for you. Also understand that we may not have an answer right now because things are changing so very rapidly. So with that, I'm going to turn it over to Kathy Chorba.
All right, thank you, Rebecca. So where do you go to learn more about telehealth? Rebecca gave you a lot of resources and a lot of really great information, but is there anything for you to download, or are there any user guides and checklists? The answer is absolutely yes. Hi, everybody. I'm Kathy Chorba, the Executive Director of the California Telehealth Resource Center. As Rebecca mentioned earlier, the CTRC, established in 2006, is a member of the National Consortium of Telehealth Resource Centers, which is funded by a grant from HRSA. The map shows that you're seeing right now shows 12 resource center regions, as well as the TRC that's responsible for each region. There are also 2 national resource centers, and one is for policy and the other is for technology. We all work independently, dedicated to serving our specific region, but we also work collaboratively so that we can develop resources as a group and distribute specialized expertise nationwide wherever it's needed. And as a consortium, we've developed a national website, which is telehealthresourcecenters.org. And on that website, you'll find links to all the regional resource centers, as well as a wealth of information. The resource documents you'll find on the national website have been created as a group collaboration using expertise from all of the TRCs. Documents that you see right now, like the COVID-19 Telehealth Toolkit, how patients can engage in telehealth, and HIPAA and telehealth, are only 3 of the many documents and infographics that range from a Telehealth 101 to how to develop and sustain your own telemedicine program. In addition to our collaborative efforts to create informational documents, each TRC has contributed resource materials that they've developed independently, but are also applicable nationwide. On this page, you'll find useful toolkits, checklists, templates, reports, directories, videos, and a bibliography of relevant and published articles. In response response to the pandemic, each individual TRC has created a COVID-19 page on their regional website, which features state-specific policy and reimbursement updates, as well as best practices for patient and provider education, workflow, and quick start guides and checklists for direct-to-consumer telehealth. This is a, whoopsie. There we go. This is a short list of the resources available on the caltrc.org website, which one thing that may be of particular interest to you right now will be our COVID-19 reimbursement, direct-to-consumer, and general COVID-19 website pages. The National Consortium also hosts a monthly webinar series that's offered on the third Thursday of each month. Topics on these webinars could range from policy and reimbursement updates, clinical workflow and best practices, to telehealth program development and sustainability. You can find a listing of the upcoming presentations on the national website, so please click in, sign up, and join us. We also record and archive our webinars so that you can watch them at a time that's most convenient for you. So basically the key takeaways here are the telehealth environment changes rapidly. We've seen a lot of changes in the last 30 days, and we anticipate more changes to come throughout the year. And it's our job to keep up with the information as it comes in so that we can be the best service to you. So please visit our website for up-to-date resources and information. Send us an email if you have any specific questions, or give us a call if you prefer to have a discussion. For those of you who are more of a do-it-yourself type, our websites are designed to give you all the information that you need to get started and to succeed. And best of all, everything is free to you because we're federally funded. And finally, because we are a consortium, when you contact your regional resource center, you can do so knowing that they have the power of the national consortium behind them whenever it's needed. So I'd like to thank you with that, and for checking in and visiting with us on our webinar, and just to let you know that we are here from you. Like I said, just give us a call, visit our website, and let us know how you're doing. Thank you.